for attending today, attending the coalition's introduction of our newest vendor partner, Care Advocacy Association. Really appreciate you all being here and committing your time. I know your time is really valuable, and just wanted to say we really appreciate it. We're going to talk about some topics today that may be a little uncomfortable. Uh, I know we're going to talk about the aging process. Um, in our society, we really don't like talking about getting older. We all want to stay young forever, but that's just not going to happen. Uh, we don't like talking about loved ones getting older, our parents or our grandparents, maybe that favorite aunt and uncle. We don't like talking about decline in their health as they get older because that does happen, but sometimes we just don't want to see that. Uh, but at some point, and it's happened to me, at some point, we become caregivers for our loved ones. And if you don't know what to do in that situation, it really can be difficult. From my own experience, if you don't know how to navigate Medicare, maybe Medicaid, if you have to, the different insurances, the healthcare system, even at home assistance. If you don't know how to navigate all that, it is really difficult. So I was just so happy when the coalition found Care Advocacy Association. They are experts in this realm of issues that we all know we're going to have to face at some point, that we're not prepared to face when it happens. It can happen. It can happen in the blink of an eye, unfortunately, or it can slowly happen over several years, and hopefully you have time to prepare for it. Uh, I really like what Care Advocacy Association does. Uh, I like I like the opportunity to intervene and assist our loved ones as they age, and and I really hope you pay attention today because this is something that will affect your entire staff and faculty in ways that you cannot imagine. So if you have questions, I know Chris, I'm about to turn it over to you. I know if you have questions, we'll make this very interactive. Stop Chris at any point asking questions, but please enjoy this presentation. And with that, I will turn it over to Chris Carpino with Care Advocacy Association.
Thank you, Lion, and thank you everybody for your time. I'm grateful. I appreciate it. With me today is Roslyn, who is our Chief Marketing Officer, as well as a seasoned caregiver in life, as most of us have been. I'm Chris Carpino. I'm the Executive Director of our association, and I have spent the last 30 years in the employee benefits business. And the thing that really troubled me going back 30 virtually 30 years ago when I was a caregiver for the second time in my life for my mother with home hospice and then end of life with my father caring for her was I was in the benefit business, and I realized that while paternalistic employers and benefit brokers have good intentions and best efforts, and they're subject matter experts in so many areas, that the extended family that we all have, your mom, your dad, your grandmother, your grandparents, uncles, in-laws, etc., uh, certainly can't access the traditional benefits that maybe your employees offer. And then today's world, decades later, here we are. The internet and AI has not helped. Certainly, AI isn't a solution. I'm proud that while we do have AI engineers on our team for software purposes, we don't use any AI. We're HI driven, human intelligence. We're really people talking to people who care, who have been in others' shoes. So I'm going to put up our really introduction website. I say that because there's things here that are not a secret in any way, but there's some content that an employee would not see. I'm humbled to say that we have a handful of not only state associations, but a few sold schools. One of them is going live in about 3 weeks. um, because we're solving multiple problems, and our platform, as you're about to see, it doesn't cost anything for you as an employer or as an influencer really for your school to offer our solutions, which are advocacy focused. We are for profit, so there are products and programs that we do receive compensation for, which we're transparent about. But it really begins with the reality of, regardless to how rich, let's say, of a benefit program you might have, uh, our intention is to speak to your employees, teammates, faculty, full-time and part-time employees, contract and seasonal workers, everyone to on behalf of their mother, father, and their senior loved ones. And the math is pretty simple in the United States. The average person in America, at least US worker age, has five seniors in their life. And if you reflect on your own, family circle, or maybe like me, that's small, but your spouse or significant other's family, it's not uncommon for one of your employees to have five, seven seniors in their life that can be impacting really their focus and ability to be as productive as possible. So, for those of you like me, who clearly remember Jimmy Carter and former First Lady Rosalind Carter, her quote stands solid today and maybe more impactful than ever down at the bottom here. And that is, there are four kinds of people in the world: those who have been caregivers, those who are currently caregivers. That's me today. Now with my father, I mentioned he's 85 and just moved him into an assisted facility home. Those who will be caregivers and those who will need caregiving. So I'll get into the meat of it here. We are the CAA. Our business partner behind the scenes, although you won't see it anywhere on our website, is Gallagher Insurance, a household name for some. They are the second or third world's largest broker. I'm not a big fan on bigger is better, but this team is just wonderful with whom we deal with. I've worked closely with Aon and Mercer over my career and some of the other names, and Gallagher has just been a blessing to us with what we're doing. So coming back to one of my comments, we're truly focused on one-on-one engagement and support, really on a concierge level, like delivery to speak to and help your employees, senior family members. That said, in the United States, 19.5% of US workers are 65 or older today. So they have some crucial decisions to make, often around Medicare and some other just aging, in place and aging well decisions at certain ages. So we do offer some of the programs that you'll see, for your employees themselves, but we're not competing with any of your employee benefits. We don't interface with payroll systems. We don't need HRIS or Ben Admin or Plan Source or CoreStream or whatever benefit system you might have. We have no need to integrate with them. We're freestanding. We're not narrow to one time a year with an open enrollment because, as Lion was saying, and thank you again, Lion, for arranging this, caregiving happens at any given point. We also have the privilege and luxury with Gallagher as our partner to have the purchasing power of over 10 million members within the Gallagher Association world. So you're going to see some things that you may not have seen before, or you're going to look at some things that are significantly, I was going to say ridiculous because one is ridiculously priced because of our buying power. But at the end of the day, our focus as a business partner for you and for other cohorts within your executive teams is really focusing on what is happening with caregiving for employers. And whether it's CFO magazine from last year calling out that CFOs need to take action because of a productivity impact, absenteeism, presenteeism, FMLA or just general LOA leaves, right, etc. Forbes magazine calling on CEOs, you need to pay attention to caregiving. It's a resource strain, and then backed by AARP, and then SHRM calling out that second to health insurance, the number one demanded employee benefit from a white paper they put together last year was caregiving support. So with that, I'm going to segue back to really AARP because I want to show you now for the next 7, 8, 9 minutes, maybe 10 minutes at most, I think. I'm going to show you who we are. I told you a little bit about who we are, what we do, and that's the most important part, and then how we do it. Again, our program is no cost to the employer, to you, or to anyone to receive advocacy support and guidance. There are some programs that are available that really fall into essential care, like AARP is calling out. That's their article title. Caregivers account for $1 trillion in essential care. So one thing that's important and what we know from our best practices to message and show our solutions and diverse portfolio of program options is really communication and engagement. I've mentioned no AI twice, so maybe this will be the third time. But I would tell you, and happy to say, we do have some schools who have already agreed to allowing us to come on site, host a lunch and learn, host a breakfast meeting, and really in a perfect world, when it's conducive, right? Have those employees invite their family members, whoever, specifically has some questions. We do have a broad reach because of our resources. We have a national team that is fully nuanced on caregiving, and then they are segmented by their area of expertise you're about to see that are located in 300 cities. So to me, it doesn't matter where you are. We have someone nearby, to assist with or help support events that you might have, or ideally, our own specific caregiving focus, say seminar on site. But I'm going to accelerate. Let me get really to the heart of this. So, what's essential for seniors? I know that if my father I didn't have him switch from his Humana Medicare Advantage plan last year back to regular or what is often called traditional Medicare, that he would not have been in the 3 rehabs post 4 hospital stays that he was in the last 7 months. So, as you know, and whether it's the media or your office or your employees, generally everyone hates health insurance or they think the US healthcare system is broken or it's a ripoff or it's too expensive and that's why it's a ripoff until they need care, until they need significant care and your Blue Cross plan or whatever you might have, UHC, Kaiser, doesn't matter what healthcare plan you have, comes to their rescue. People don't understand their own HSA. They certainly don't understand Medicare and the many dozens of options that are out there. So, a cornerstone of aging is quality health, driven by ideally, if such a thing exists, quality health care. So we have a national team of Medicare licensed agents in all 50 states. We're always promoting pick up the phone or schedule a meeting. We want to talk to you, right? This is not some internet click buttons and self-serve, make your own decision. And it's difficult to make decisions because enrollment for Medicare is very confusing. You've got 2 time periods. You've got the first one coming up in October for traditional Medicare. Then you have a Medicare Advantage. Commercials are nonstop from Humana and Aetna and United Healthcare, and the list goes on. People are confused. And by the way, if they don't make the proper decisions at the right time, they can have a 10% penalty every year they neglected to enroll properly. So healthcare is essential, right? And the other thing that's obviously important to everyone in life, particularly in today's economic landscape, is income. It's okay, God willing, you have good health, but if you don't have a reasonable level of income, then there's other issues that affect your health, right? Stress, etc. Or maybe you do need money for care. So the second most confusing thing from our experience is Social Security. When should you elect it? I don't know, because there's about 73 different equations: married, widowed, divorced, children, adult, disabled children, spouse working, you're working, etc. 96% of people do not optimize their Social Security election. So we have a segmented team that meets with individuals, your employees directly, for their parents, jointly, etc., to really discuss Social Security and the nuances around that. And then the third leg of the stool, really, as Lion was framing, was we're aging. Certainly I am. I was 60 years old about a month ago, and I thought, what happened to the last many decades of my life? It goes fast, right? And so many people don't want to address their mortality, or they just don't want to think about, the liability that they might be carrying or burden that they have. Sometimes their adult children don't even know what that is. So there are stats out there to show a significant deficit of U.S. citizens for life insurance. At the simplest statement to make is a reality. Very few people have eight, nine, $10,000 liquid for a funeral. They don't have it. And seniors and children often don't want to talk to each other about it, right? Adult children. So we have a portfolio of over 40 different life insurance companies. You name it, we have it. We've got the experts who are licensed. Up to age 80, someone can get up to $25,000 of life insurance with no exam. And then there's more options for family members of any age. They can get up to $1 million with no exam. And that's really what we're talking about: health, income, and financial, expenses for seniors. They're our cornerstone of essential care. And then we move into just a handful of more things I'm going to talk about. This is often peace of mind, but I'm going to throw a label of lifestyle here. So many of us might remember a famous commercial or infamous commercial, "I've fallen and I can't get up," where a woman was on the ground and she had her, necklace on to push a button for a safety alert. There's a new version of that today, and it is technology driven, and it is through a mobile app. And the mobile app is voice activated, which is what's so compelling to all their users. And that is, someone can just say their programmed password. That password could be Chevrolet. And what happens is the mobile app instigates a FaceTime with your senior guardian who you chose. For me, it'd be my daughter. One of them I know would answer the phone. The other one's a little tricky. So I'd pick her. Then in addition, the same tool, the mobile app, activates a three-way text message to three other people that you've chosen to say mom's in trouble or dad needs help or give them a call, etc. And it has a lot of redundancy to it. It also it's backed by security monitoring and has many other features, which I'm not going to get into just on this call because it's robust, and it's a program that people can raise their hand, say, I want it, or they don't have to do anything. That's priced at about 50% of what it is if you were to get it independently. For me, I just adopted, I don't know, maybe my seventh or eighth dog 2 days ago. I'm a pet parent again after taking a break, having put two down a few years ago. And expense, pet health care is expensive, just like our health care, as you know. So I'm thrilled to share, besides Gallagher, we have a handful of other big, well-known, reputable companies as business partners. In this case, it's MetLife, who does provide discounts because of our association for individuals who want to take a look at getting pet insurance. So I'll take a breath there and see if anyone has any questions. I would tell you I have about 5 more minutes just to show you now the specific association programs that are meaningful, such as wills and other legal aspects. Does anyone want to stop me at this moment? Any questions? Okay, great. I'll continue. So coming back to, aging, and it's rhetorical, not that this size group is going to start chiming in, but if I were to ask a room full of people, is your will updated? When was the last time you updated your will? When was the last time your mom or dad or you reviewed what will they have? Do they have a do not resuscitate? Do you want a DNR? Do you have a healthcare directive? Do you have a general will, right? And is it updated? Generally, the answer is no. And I'm thrilled to say, because of our association, we have bundled a package of live attorneys who will draft your will and do not resuscitate healthcare directives, even pet directives. And then, just as I did recently for my father, I took it to the bank and I got it notarized, and away I went. This package, as you can see in the upper left, is a retail value of $39.95 a month. It includes live CPAs as well. So the most basic taxes. Selling my home, I live in New Jersey. What's the ramification? What do I need to prepare for? My dad has an old IRA. We didn't know about it. What should we do? Do we need to contact the IRS, etc.? So these are things that on the fly, you pick up the phone and you can speak to somebody, right? Or at minimum, schedule an appointment to speak to an attorney, get documents, speak to an accountant. And then in the scheme of things of planning, we also have an impressive, it's simple, but it has a lot of bells and whistles to it, financial advisor tool. It's not people, even though they can connect to someone as a second step, but the tool's a mobile app really to calculate things, and it's really tied to the idea of financial matters, right? For the purpose of a will and for taxes, etc. It's called Three Nickels. So the whole package is $20 if someone wants it. And this is again part of our association. Costs nothing to join the association. They can engage with our experts from above at any point. There's two other uh, bundled products that we have. And this one hits home for me, not only because it sounds nice, the rare times I might be somewhere nice when there's a concierge to help me, but it's a family concierge from one of the world's leading companies who most people don't know. They serve Fortune 500 companies generally, but as the association that we are, we have the luxury of accessing Aspire, and I've literally dealt with some of these things on the top row. And maybe you have a family member across country or not too far away that, could be in this middle here. Home modifications are not uncommon, from safety, remodeling bathrooms to tearing out steps to put in a wheelchair ramp. Does Medicaid subsidize it? Do I need to know anything about, ABC County and regulations? Who's going to help me with this stuff? I'm going to plan to sell my mom, dad's house. What should I be thinking about? And then it moves into what you would identify like concierge service, right? Travel, dining, entertainment, personal tasks, etc. So it is a lifestyle luxury, but it is priced at, again, same 19.95 a month. And then our third bundled package, I guess I'm the poster child, hits home as well, heavily to me. Dental, vision, hearing. You hear about it from your employees all the time. You already have it in your benefit package. Do their mom or dad? Do their grandparents? Do their in-laws? Maybe, maybe not. I would tell you what they don't have 100% is a hearing program like we have. My father's been through 3 sets of hearing aids in the last 15 months. They're expensive. They've gotten a lot cheaper, but they're expensive. We have a partner called Tuned, which generally serves Fortune 500 companies, and they cover 100% of appliances. So it's not only the exam that's covered, but hearing aids are covered and related hearing appliances, if you will. The package itself is worth $60, $25 a month, covers everybody in the family, mom, dad, etc. I could join because I want this, and maybe I want it for my spouse, I don't know, and I want it for her parents. Everything you see are family plans. And having had 2 hip replacements, and I broke my left shoulder in 2 places here right outside of Philadelphia, New Jersey, where I sit. It takes about 3 months to see an orthopedic specialist. Now, for my needs, it wouldn't have worked. But we have an orthopedic care program that's a complement to the dental, vision, and hearing. That's part of this bundle. So these are all optional or voluntary benefits, whatever you want to call it. All pay, no payroll deduction. An employee or family member, again, can distribute it or hold their mom or dad or grandmother's hand and walk them through, and you'll see how easy it is to click a button and register. But because of Lion and because of this relationship with the Coalition for College Savings, we have a special, extra special program with our good partner, Allstate. I've dealt with them for decades. I know their leadership well, but it's really a combination of the buying power of Gallagher and who Lion and Anita and the coalition is that we have this opportunity. And it's simply positioned as if you join as a premium member to our association, it is $4.95 a month. What do I get? Well, if I join Costco, I get to walk through the doors, right? I pay them their fees. With us, for the premium membership, you or your employees and you, right, can receive their elder family cybersecurity and ID theft program that today on their website, Allstate's website, is $34.99 a month because it covers up to 10 family members. And it's much more than just generic online ID theft tools. Full restoration is included with people. You get a case manager, etc. But what I liked the most was really the basics. What should I know about dealing with my father's ID, protection, and what should I think about? Or maybe, I have a father, mother, or relative who thinks they know everything and they really don't want to be approached about it. It's a nice, gentle way to have a learning process around what you should be protecting. So that is, again, join it as a premium membership. I'll stick with that Costco membership example. We charge $5 a month and to qualify as a premium member, and everybody, or at least 10 people, receive a $420 program, right? $35 times 12. So that's pretty much who we are, what we do, and how we do it. This is just echoing the how we do it part. We want to support our partners with ongoing education, whether it's virtual or in person. I think we've torn down the barriers to make it easy to get started, which is why we're so fortunate to have a couple schools getting ready to go live just 30 days after this our rollout here. Our onboarding processes are these 3 steps. We don't have a complex legal document. Again, there's no cost for you as the employer. We have a letter of agreement, literally about 120 some words, that says, look, we get it. We've met, we've talked, we've gotten to know each other, we've learned about your culture, your objectives, etc. You agree that, and we agree that we need the support through education. And we must send out emails to invite everyone to a kickoff, and we want to promote our monthly webinars every month, ongoing, month over month. And this simple document gets put on your letterhead, you sign it, and we are good to go as partners. We've made it simple with crafting sample email communication. Dear Lion, we're excited to share. We have a new caregiving benefits, no cost to you, right? Or your loved ones. And it's designed to support your parents, grandparents, and loved ones, right? So I'm beating that to death. Um, And that is a summary. On the sample websites that you're looking at here, you can go up to the top page in the navigation bar. There's a program summary you can click on that shows the highlights, right, of the features and the benefits. It's also, I think, important for me to message that all our sites, all our client partners receive a custom website. So that would include your logo, your colors. We can also collaborate. I had someone ask me to meet with their broker. Their broker has a special program related to their 403B or something like that that they wanted us to promote on the website. We want good business partners. So sure, we'll do that. And then additionally, from a stewardship uh, and a thoughtful approach. The other reason the websites are custom branded is that we want to report to you success, activity, tracking, how many people joined, how many, are engaging, etc. So we want to be, a good partner and be accountable uh, with full transparency. And with that, I'll take a breath finally.
Well, Chris, let's open it up and ask if there are any questions among the attendees. And don't be bashful. Believe me, I've asked a lot of questions along the way. All right, we have one in the chat. I see. What's the starting age for seniors with this program? Good question.
Yeah, so a little tricky wording. So I'm 60, but I need the services here. Um, I was first a caregiver for my mother when I was 23. So there's no age requirement. Now, I'll try to get a little bit more specific to your reading the words you wrote, and that is Medicare starts at 65. So other than that, there's no barriers or restriction for any education, support, advocacy, or any of the programs. There's no age restriction. Either way, younger or older. I hope that helps.
We have another question, Chris. Uh, Kathy asked, I missed the cost for the pet care. Could you please repeat?
Yeah, so I didn't mention the cost because pet insurance, and I've been involved in that industry for 20 years or so, varies based on the age of your pet, the weight of your pet, the type of pet that you have, and then uniquely with MetLife, they cover more than one pet on one policy. I will tell you if you just Google pet insurance and try not to put personal information in there because your phone will ring off the hook. Um, you'll find that having many pets in my life, pet insurance ranges generally from about about $30 a month to upwards of $100. I had a large, kind of overweight, older dog, and he was expensive. I also had the other end of it. So it's speaking for the industry. I'd say the price spectrums are 25 to $100, depending on your pet, age, weight matters, and breed. And I say depending on your pet, what breed you have. So it varies. So when you go through our journey with MetLife, it's a easy one. You answer a few questions, it gives you the price.
Chris, another question we have. What's the best way to get started with the program?
So we would ask Rosalind and I to meet with you. So just so we understand, what your objectives are. I mean, generally, look, we're casting a large net. Everyone has a caregiving story, pretty much. Um, but I would tell you that, let's say we had that meeting today, you told us, we got to learn a little bit more about how you communicate, what's worked effectively for you. Maybe you haven't, we want to ask some questions to learn, right? Maybe you have an EAP in place that you think does some of what we do, but it doesn't. Let's talk about that because generally employers have one or two EAPs, et cetera. And then we build and test and launch and then collaborate with your approval websites within 15 days, your custom site. Then we want pre-communication. Critical for success is not just the emails to the employees. A perfect blueprint and on a 12-step milestone document we have is the request that we meet with your department leaders separately so that they can help cascade the message to employees. But simplest answer is you sign the LOA, letter of agreement. We define you get some details from you, and we're up and running within 30 days.
And a follow-up to that is, do we go through the coalition or straight to you? And will you be sending information out after this call?
So straight to me. Um, and Rosalind, but to us, right? We have many other people behind us, but to us. And yes, I'll send the link and I'll send some other details. We've got a couple other documents. I've got a one pager that speaks well to CFOs and other cohorts. It's funny. I feel fortunate. So it's not literally funny, but it's unusual. Just this past week, I had two schools, one push out an email to Anita, which she's terrific, the coalition, and she sent to us and replied to the person. But it was a CFO who saw the announcement, who then pinged HR to say, "Did you see this?" And then HR contacted Anita, and then we all collaborated and had a meeting. But additionally, same thing happened, except it was the president of the college. So I say that because yes, I'll be sending something that kind of addresses the financial piece, CFOs, productivity, business aspect, and then SHRM, right, the HR aspect.
And Chris, I'll just add that Care Advocacy Association or any of the other vendor partners, the coalition is happy to facilitate coordination of communication between our vendor partners and the school. If for some reason you miss Chris's email or it gets stuck in spam somewhere, if you haven't seen that in a couple of days, then just reach out to the coalition and we'll be sure to get you where you need to go.
Chris, did you mention that the pricing packages are the same for alumni offerings as they are for the faculty and staff?
No, thank you, Mike. And I have it written right in front of me on a piece of paper. Um, so we are by design, and I've worked in the collegiate space off and on for a while, but we do have traction this early on with alumni groups, right? So yeah, so we focus on employees, yes, and their loved ones, but for your peers, colleagues, alumni directors, etc., not only do they have the opportunity for the same exact thing, but because they're the alumni uh, division, we have marketing subsidies, marketing fees that we pay the alumni. So that's a big conversation on any alumni size, because if you think about where I was, a 5 times multiple, if there's an alumni group with 30,000 or 100,000 members, you want to times it by 5 because that's the potential audience of seniors. And we have a compensation package to promote us, which frankly they expect or want, right? Pay to play. You want to be on our website. You want to gain access to our alumni. We're going to charge you. We get it. And we're fully positioned to have a financial conversation, which can push big high five figures, could be six figures, depending on the size of the alumni of recurring revenue. So that's the other reason for us to have the kind of connectivity of CFOs, presidents, and HR. But thank you, Mike, for bringing that up.
I knew we asked Mike to join for a reason, Chris.
I thank you, Lion. I wanted to say something like that, but I'm trying to have some decorum here.
Here's the next question. How many schools have started this program so far, and will the presentation be shared?
Yes, to the latter. And we have four. We have one. First is going live September 15th. We've only been officially partnered with the coalition for about 30 days, but we have three others committed and a fourth for next year. So I have four schools pending is a short answer to launch. We've secured letters of agreement. We're building a couple of the websites, etc. I would tell you, not that this was the question, but I have been in the caregiving space professionally for well over 11 years. I know all the players who are out there, and they're very good, and I have deep relationships with most of their founders and CEOs. But the myopic caregiving programs do not do what we do. They are hyper focused, to their credit, on the employee's mental well-being. So Caroloop, Wealthy, Family First, Torchlight, Clio, I know them all. I know a handful of their executive leaders. They were on my old platform I built 10 years ago. Everyone I just named. They do a great job for mental well-being, but that's not who we are, right? We're focused on essential care, health, financial, and then really mortality and final, aging planning, etc. So I personally have had clients like ADP Total Source, a division of ADP, and many other, a handful of Fortune 500 companies that I have experience with in deploying caregiving benefits. Not my first rodeo, that's what I'm trying to say. Professionally with caregiving.
I can also tell the group that the coalition takes the responsibility of bringing on a new vendor partner very seriously. We do a lot of vetting before you ever see a vendor presented to you. So we put Care Advocacy Association along with its competitors through hoops before we selected one. Chris knows.
I'm trying not to comment. I think my face.
So
yes, I agree.
we definitely vet these vendors before we ever let them loose on the schools.
Yes, thorough vetting. Although I did sneak in under the 12-month mark, barely.
Other questions that people may have or the group may have. These have been good. Well, Chris, I don't see any. Thank you for your time today. Thank everyone for attending, and Chris and Rosalind, we thank you all.
Thank you.
Yeah, we're thrilled.
I was just going to say, to me, this is an exciting program because as a former CFO at a couple of colleges, and I was over HR at both, to me, it's an extension of the HR office, and it gives the HR office expertise that normally they don't have. And now they can answer questions that they may have been uncomfortable answering before. So it just broadens the HR department's abilities. So thank you very much.
Appreciate everybody. Thank you, Lion. Thank you, everyone. We'd love to talk to you, meet with you, follow your direction.
All right. Take care, everyone.
Thank you. Bye.
Bye-bye.
Bye-bye.